Dr. Fauci, would like to retake that question about herd immunity, because many people are concerned that we are never going to get there here in the United States.
Yeah, Melissa, you asked that question about herd immunity. Let me explain. The concept of herd immunity is when you get enough people who are vaccinated plus people who've been infected, recovered, and have immunity. When you add them together, if you get enough people to have a blanket of protection over the community, that's called herd immunity. The herd immunity threshold is what that number is, what that percentage is. We don't know yet what that is for COVID-19. We know what it is for measles because we have decades of experience with measles. So it isn't that we're not going to reach it, but we don't know what that exact number is. So when you don't know what the number is, the thing we do is say, get as many people vaccinated as quickly as you possibly can, and whatever that number is, sooner or later you're going to reach it. So that's the reason why we say just go and get vaccinated, and don't worry about this number that we're really not quite sure what it is yet. That's the answer to your question.
Thank you. And we have another question there.
Hi, good evening, everyone. Hi, Dr. Fauci. I'm a big fan. My question is, what research is available about the side effects of the vaccine on pregnant women and their unborn children?
Did you hear that, Dr. Fauci?
Well, tell us your name.
Oh, sorry, I forgot. My name is Nisreen.
Nisreen.
Yes.
Okay, well, Nisreen, thanks for that question. And you know, my kids are small, and it wasn't that long ago that my wife was pregnant. And I remember at the time that I was so preoccupied with her health and the health of our child. And so I think it's good to ask these questions because we want pregnant women to be safe. We want their kids to be safe. And I think the good news that we have with the vaccine is that at this point, we have a large number of people in America who are pregnant who have received the vaccine. And it's continued to have a very strong safety profile. The CDC has been tracking this data. And in fact, they release periodic reports on what they're finding. And most recently, their report, when they looked at people who received the vaccine in their third trimester, was that both the moms did well and the babies did well. And they're continuing to look at more and more data. But keep in mind that the first wave of people who got this vaccine were healthcare workers, nurses and doctors and others, health professionals. And many of them were pregnant, and they chose to receive it because they knew one final thing here, which is that the risk of getting COVID if you're pregnant is serious, because then people who are pregnant, women have worse outcomes, and the babies actually have adverse outcomes when COVID hits. And that's why we want to protect pregnant women against COVID at all costs. That's why it's such good news that the benefits of this vaccine are high and the risks very low in women who are pregnant.
Hey, thanks for watching our YouTube channel. You should know that you can follow today's top stories and breaking news and catch up on your favorite MSNBC shows all in one place. Download the NBC News app today.